Hey guys, my name is Amy. I'm going to be doing your yoga flows with you. You'll be watching this video whether you be doing the online series or you're coming in to see me in person in our Sunshine Coast yoga classes. So I just wanted to talk through a few kind of tips that's handy to know when coming into a class, especially if you're pretty new to yoga. You definitely don't have to be experienced whatsoever to be able to do our pregnancy yoga classes. In fact, we have so many women that actually do yoga for the first time during their pregnancy with us here at Natural Birth Coast. So a few tips that I wanted to give you. First of all is about our props. So these are called blocks. Now, a block is really handy to use. However, if you're at home, you can absolutely just use a big, thick book or even some tin cans, even a big, tall jar. It's really used as an extension of your arm in whichever way you wanted to look at it. So a few examples here is, say if we're in a lunge position and you're down low like this. Whereas sometimes this can feel a little too low, it's a little too much on the joints. You can simply use a block to lift yourself up a little bit higher, and that can make it a lot easier. Another example will be if the block's on the inside, you might have one hand on the block and you might have one hand in the sky. And that's just a little easier and a little bit less restricting to that side body than having the hand on the ground. Another example might be if you come into a forward fold, if leaning over is a bit too much or you get a bit too refluxy, you can use the block and lift yourself up that way. Great. So that is our blocks. Essentially, remember, extensions of the arms. If ever you have a feeling or a thought that, oh, that floor is just that little bit too far away, grab a hold of your block. You don't have to even wait till when I say that you can use it as an option. It can be used at any time. Anything is always an option. The next thing is our bolster. Now, this is a really fantastic prop. And again, if you're at home, you don't have to have one of these. But if you can get these props, it is going to be so beneficial to your yoga practice. Especially if you've still got some time, you will definitely get some great use out of them. If you don't want to or can't get a bolster, then using a few really hard cushions can be great as well, especially the longer ones for some of the positions that we do with the bolster, or you can even stack a few cushions together to get some nice height, because the bolster, like a cushion, but it is very hard and thick. So it provides actually a really great support and some height for whatever you're doing on your bolster. You might be sitting on it, you might be placing your knee on it, and it's going to give you some extra height. Next thing I wanted to talk about is some of the adaptations with the movements that you can do. Now, I may not say this with every single movement, however, absolutely every single movement in pregnancy yoga, you can adapt into a way that is comfortable for you. So you might come forward onto your hands and knees. As an example, we quite often might go from downward dog, Ardha Mukha Savasana, to three-legged dog, extending a leg up to the sky and bending that knee into the shoulder, placing the foot to the outside of the hand. That's a common move that we can do. Now, at different stages of pregnancy, this might feel a little bit more stretchy and difficult. So a couple of options here is you can go from three-legged dog, place the foot down to the mat here, and use your hand to assist you in bringing that foot forward, okay? That's absolutely more than fine. What you can then do is using either your block to help as an assistance to get up into your lunge, or you can bring your hand onto your knee and use that as an assistance to get up to your lunge. Either or is perfectly fine. Now, if that is still a bit too stretchy, that's so fine. You can have the hands underneath the shoulders and knees under the hips in our typical all fours position, rather than being in your downward dog. You can then extend this right leg like you would a three-legged dog and bend the right knee into the shoulder and place the foot next to the hand, or use the hand to help it to the top of the mat. You can then from here get into your normal lunge position as you would. The next movement we're going to talk about that's quite common is our Chaturanga Dandasana. So what this is that say if we have just done a flow, a lunge flow, and we are coming into our Chaturanga Dandasana. So we might step from the front of the mat to the back of the mat and come forward into a plank position. A couple of options here that might be suitable for you. So what our normal Chaturanga Dandasana is in non-pregnancy yoga is we're in a plank. We push forward through the toes, bend the arms, come to a hover, push through into your cobra, and then we come up and over into your downward dog. Now, that's absolutely an option if a cobra still feels good for you in pregnancy. Quite often it doesn't because one, you'd have to lay on your belly, which isn't comfortable, or two, the stretchiness along the front of the belly can sometimes be a bit too intense. So I don't encourage you to do that if it causes you pain. If you're experiencing too much stretch here, it is a great sign to stretch it. However, falling into a cobra isn't a great way to do that. So that's option number one, is doing a normal Chaturanga Dandasana. What the second option is we come into a full half plank position, which is where my tailbone is gently tucked under. Then you bend the elbows to the back of the room, halfway lifting up and lifting all the way up. Walk the hands to the knees. Bring the fingertips behind the sacrum. As you inhale, puff the chest forward, draw the shoulder blades together. This can be our pregnancy version of an upward dog or a cobra position. Other than our pregnancy upward dog is coming forward to a puppy pose where the hands are walked forward and the chest bows down to the mat. The sits bones are stacked on top of the knees. Or is to come into a good old favorite child pose with the knees nice and wide, letting the whole torso relax down. And last but not least, if you wanted to come from your half plank position where you are bending the elbows, lifting up, come into your cat-cow and take a round of cat-cow as your version of a cobra before we move on into the next position. Now, another thing in regards to movement is that at any stage throughout your yoga practice, you could be due to reflux, it could be due to being tired, you could just feel like it. You can resume child pose or Valasana at any time. So Valasana is this position that I'm in, and you can absolutely have a bolster in between the legs. Now, you can also be in your child's pose where the knees are nice and wide and you are leaning forward, relaxing onto the mat. This can be leaning forward onto a bolster or with the bolster in between the knees. These positions at any stage through yoga, you can resume while we're all doing our own little flows around you. Now, I just wanted to quickly talk about the core during pregnancy. So it is okay to ignite the core during pregnancy. We don't want to do crunches activating our six-pack abs. However, it is actually really healthy for pregnant women to work their core because we are able to actually, one, reduce the amount of abdominal separation you get during pregnancy, and two, we're able to have a much better postnatal recovery. So when it comes to core work, if I tell you to ignite your core, what I mean is draw the navel to the spine, tuck the ribs under and draw the ribs down towards the hips. Wrap the left waist around through center, the right waist around through center, zip up the waist through the middle. So we've got this really bulletproof core here that you're not moving around, flailing about in. We use this in Pilates, we use this in yoga. And you can do this to 100%, you can do it to 50%, depending on the type of movement that we're doing. But we're talking about all those points, including the pelvic floor contracting from beneath, when we talk about igniting our core. Now, a couple of pregnancy-specific things that I just wanted to discuss is that your blood volume actually increases by 50% during pregnancy. You imagine this is a huge amount of extra blood to pump around your body, so you get exhausted much quicker. If you're a bit further along through your pregnancy or you're just feeling a little bit tired, something that I want to remind you of is that pregnancy is not a time to be hitting BBs. Pregnancy is not a time to be learning new yoga moves. Pregnancy is a time to move nourishingly our bodies while preparing for a natural birth, okay? So I really encourage you to not necessarily challenge yourself too hard during pregnancy. If you're feeling breathless, let yourself take a breather. If you need a break, have a break. You don't need to be keeping up with everyone the whole time. You can very much take a self-led practice through yoga. The other thing I wanted to explain is that in pregnancy, often going from sitting to standing or from forward fold to an upward stance, you can get a little bit lightheaded, and I'll show you an example. So quite often in yoga, we will be in an Uttanasana forward fold and we'll take a deep inhale, round the hands up to the sky, and exhale, hands to heart center. Now this isn't uncommon. What can happen is you can get a little bit lightheaded going from forward fold to standing. So what can be really helpful, especially if you know that you're prone to a bit of lightheadedness, is that when we're in our Uttanasana forward fold, bend the knees, gaze forward. Inhale, round the hands to the sky. Exhale, hands to heart center. Letting the knees bend and the bum to come down and you gaze forward just stabilizes your blood pressure that extra second before you launch yourself up to the sky. Now, I'm sure most of you have heard of the hormone called relaxin. This hormone allows everything in your body to become more stretchy. Now, yes, this includes your muscles, but it also includes your joints and your ligaments. Now, the joints and the ligaments, we really don't want to overstretch. Muscles, we can stretch, they contract, we stretch, they contract, they can heal really well. Joints and ligaments don't heal very well, and they're not meant to have heaps and heaps of stretch in them, right? So when we have all this beautiful extra relaxin in our bodies, if we are to really crank through a stretch, say if we're in a forward fold and we're really cranking this stretch hard and the muscle has reached its capacity of length, that muscle's then going to pull on the joint and the ligaments, and that's going to create an excess of stretch in the ligaments and the joints. Now, this may not necessarily cause problems in pregnancy, however, it can very much cause problems in the postnatal time. So I really encourage my pregnant mamas, yes, we want to stretch and build flexibility in pregnancy. Let yourself feel the stretch, don't crank into the stretch. Just be kind with yourself and let the stretch be there. Now, just two more things. When we talk about getting from a seated position to a laying down position, it's really important, as I said before, to not use your abdominals, your six-pack abs during pregnancy. So we don't want to be kind of laying back like this or even laying back like this and using our arms once we're back here. We really want to use our arms the whole way around as support. So for example, from a seated position, you can bring your feet forward, lift the hips to the side, use your arms to assist you to fully lay down. So we're not having to use and crunch our six-pack abs. Same as when we lift up, using our arms to lift ourselves on up, so we're not using our six-pack abs. Rather than crunching ourselves up, we definitely don't want to be doing that doming through the belly. And last but not least, symphysis pubis pain, also known as pelvic girdle pain. So essentially, if you're feeling any pain in the joints in the pelvis, so the symphysis pubis at the front or the two sacroiliac joints at the back, this is referred to as pelvic girdle pain. Now, pelvic girdle pain is pain in the symphysis pubis joint at the front or the two sacroiliac joints at the back. Now, when it comes to pelvic girdle pain, there's so many different severities and there's not a one size fits all. Now, we can reduce it, we can have mild pelvic girdle pain, or we can have quite severe pelvic girdle pain. Now, if you're experiencing severe pelvic girdle pain, I really recommend seeing a women's health physio, but still doing the yoga flow and doing these next few recommendations that I say. So depending on the severity, you're either one, avoiding these things completely, or two, doing these things with complete awareness, and if it creates pain, stop straight away. So first of all, when we've got pelvic girdle pain, we want to keep weight equally in both legs, okay? So what this may look like is no vrikshasana, which is tree pose, okay? Obviously that's weight all in one leg, none in the other. This is going to cause quite a dissociation of the hips, which isn't great if you're already experiencing pain. It's just going to create more pain and more imbalance, okay? Another thing may be the degree of lunges. Some women in pregnancy with no pelvic girdle pain can get these beautiful long lunges. However, if you're experiencing pelvic girdle pain, you might be able to get away with a slightly shorter lunge, but if that's still causing you pain, it's a bit more severe, and you might not be able to do a lunge at all without pain, and that's okay, keeping both feet perfectly grounded into the mat. Now, again, depending on the severity, if we're to do a wide-legged stance, where yes, we have equal weight in the feet, if it's pretty mild pelvic girdle pain, you're probably okay doing positions where we've got wide legs, but we've got equal weight. If it's a bit more severe, then this may feel too triggering for you and you need to either take it in closer or completely together, keeping the legs zipped up. Now, again, depending on severity, if you're more on the severe side of pelvic girdle pain, doing something like a pigeon pose might not be a good idea. You can always try it, but if it's a bit too intense, I'd avoid it. If it's pretty mild, you might be able to go okay with just a block underneath the booty to keep that side that's bent supported. What can also be helpful is letting the booty actually come down or even be rested on the block still, but have this left leg bent. And then you might come around with your bolster and let yourself relax down onto the bolster in whichever way is best for you. If you're experiencing some pretty mild pelvic girdle pain, our body balance workshop is actually perfect for you and can really help minimize, reduce, and prevent pelvic girdle pain. If it's a bit more on the severe side, I definitely recommend seeing a women's health physio. I have a few ones that I recommend here on the sunny coast and online on my website. Otherwise, you can have a Google of your favorite women's health physio or ask other healthcare professionals that you trust in your area. Thank you so much, mamas. I'm so excited for you to get into today's video. If you're jumping on online with us, you'll be seeing Jazz and Soph in the next intro video. And if you're coming to our in-person studio, I super look forward to seeing you soon.